Since the Supreme Court overturned Roe v. Wade, taxpayer money has been poured into what are known as crisis pregnancy centers. These controversial organizations have a long-stated mission to discourage pregnant women from seeking abortions. At least 18 states fund crisis pregnancy centers, but no state has spent more money on them than the state of Texas. Caitlin Huey-Burns and the CBS News investigative team, in partnership with ProPublica, spent months looking into where all this money is going. Caitlin joins us now with the results. Caitlin, good morning to you.
Good morning to you, Gail. Well, while Texas passed law after law limiting abortion access, it was also spending more money on a program called Alternatives to Abortion, which includes funds for crisis pregnancy centers. But our investigation found little accountability for how that money is being spent. And it could be coming at the expense of other crucial services for young mothers in need.
Every day, nurse Megan Wheeler drives across the Texas Brazos Valley, caring for new young mothers.
Good morning, how are you?
Like 16-year-old Ava Bradley and her 1-year-old son, Mateo.
Thank you.
They connected through the Nurse Family Partnership, a free program that pairs nurses with low-income first-time moms. Nurses like Wheeler cover just about everything, from the latest ear infection.
Any fever for either of you, or just?
No.
To making sure mom is okay, too.
How's school been this week?
Pretty good. I'm a little behind. You want some?
It's a model that's shown to improve maternal and infant health outcomes, says the program's nursing practice manager, Angela Montez.
Nurses have been able to intervene and be able to save our women and children from dying.
Because they're there.
Because they're there.
But in a state where teen pregnancy is on the rise, the program is struggling to meet demand.
We're able to serve maybe a quarter of the referrals.
So last year, the program asked the Texas legislature for an extra $19 million. They got just $2.2 million. Meanwhile, the state program called Alternatives to Abortion, which includes funding for crisis pregnancy centers, got so much money last year, it had $14 million left over for future use. It's also referring thousands to the nursing program that helped Bradley, but it does not fund it. For years, Democratic State Representative Donna Howard has questioned how Alternatives to Abortion operates.
I don't know of any other program that the state administers that is treated in the same way, not one.
Alternatives to Abortion grantees offers services like counseling, classes, and material goods like diapers and formula. But more than 40% of the services provided since 2021 were categorized as educational materials, a vague designation.
What is that? It's a material.
There's some speculation here, but I'm thinking pamphlets, one-pagers, that sort of thing.
So a pamphlet counts as a service?
Is an educational material as a service, yes.
Yeah.
A CBS News and ProPublica investigation uncovered a payment model that allows the program's largest contractor, Texas Pregnancy Care Network, to charge the state $14 for handing out a pamphlet as part of its services.
This amendment would add $25 million in supplemental funding.
Republican State Representative Jeff Leach is one of the program's most ardent supporters.
This program is really meant to provide the full weight and support and resources of the state government, not just before pregnancy, but after pregnancy as well.
But there have been issues.
The money was meant to help pregnant women and parents with young children.
A San Antonio nonprofit was kicked out of Alternatives to Abortion after a local news station reported it was using program funds on vacations, a motorcycle, and a smoke shop. The nonprofit did not respond to our questions.
If taxpayer dollars aren't being spent appropriately, then we will hold those responsible accountable.
Are you concerned that this program is ripe for fraud?
No, I'm not. We should be giving them more resources, not less.
Invoices we obtained show the program's second largest contractor, Human Coalition, spent roughly $2 million of its state funding every year since 2019 on marketing costs. That's 10 times more than what it spent on direct client assistance, like diapers.
$2 million for marketing. Wow, that is astounding. Seems extremely inappropriate.
Representative Leach said the marketing costs were necessary to create awareness.
Ooh, that one's big, though.
Holly McDaniel runs the Austin Diaper Bank, a nonprofit that distributes diapers to places like this food pantry, where every week a stream of cars lines up for free baby supplies. Diaper banks sought state funding last year, but got nothing.
There we go.
You're welcome.
There are families out there and really good organizations out there doing good work and serving those families. I would love to give them diapers, but diapers don't grow on trees.
Now, for months, we sought interviews with Texas health officials, but in an email, a spokesperson said they take stewardship of taxpayer dollars very seriously. And Human Coalition told us marketing helps them reach more women. And Texas Pregnancy Care Network told us its services are in line with its state contract and responsive to clients' needs. And also of note, last September, the Alternatives to Abortion program, it got a new name. It's now called Thriving Texas Families. Nate?
Caitlin, great reporting on the topic that is on the top of our minds, both personally and politically. For more on our investigation, go to cbsnews.com or ProPublica.org.